This is 90.7 FM, listener-supported radio for open ears, WGXC, Acre, Catskill, Hudson. So welcome back, listeners. This is Talk with Tanner, or Holla at Holly, and I'm here with Carl. I feel like I can't hear myself, though. There I go. With Carl Quinn from Twin County Recovery Services, Inc. So welcome, Carl.
Thank you.
Thanks for being here. Last minute, he was told at 2 o'clock that he was coming on the radio, so...
Never a dull moment.
Never a dull moment. Here he is. That's right. So yeah, that was one thing that caught my eye and made me think, oh, Twin Counties would be fun to have on the radio. The banner that's on Green Street that says April is Alcohol Awareness Month. What does that mean?
So Alcohol Awareness Month is a program that's organized by the National Council of Alcoholism and Drug Dependence, and it's a way of providing outreach and education regarding the dangers of alcoholism.
Okay.
And so it goes on for the entire month of April. Twin Counties is lucky enough to have our own prevention program, headed up by Paula Chiarillo. So there's a lot of focus that happens between Columbia and Greene County for the Alcohol Awareness Month, in addition to the other things that we focus on.
And which is a lot. I know you focus, Twin County focuses on a lot. And so you mentioned at the beginning, because I flubbed the name, that initially, so Twin County started in 1973,
1974,
and the focus was mostly alcohol based.
Alcohol was the primary disorder.
Yes.
That was prevalent during that time.
Right.
And not that it's less prevalent now. We actually do still deal with a fair amount of alcohol related issues.
Right.
Clients.
Right.
But the primary focus, of course, is that we're in a national epidemic with the heroin epidemic.
And what an epidemic it is.
Absolutely.
Horrifying, isn't it?
Absolutely. It's unbelievable the number of people that we're losing, not just here in our community, but around the state and around the country.
Yeah.
To the disease of addiction.
Right, absolutely. So jump back to the Alcohol Awareness Month for just a little bit. So who put the banner up? That's a Twin County thing, or the city of Hudson?
It was a joint coalition effort between Twin Counties and some of the other groups that are participating between Columbia and Greene County.
Okay. Very nice.
So the banners, actually, I think one of them was moved to Greene County.
Oh, okay.
So that it's a dual county effort.
And so its purpose is to drive awareness of the potential issues?
But the issues and resources and treatment that are available. It doesn't have to be a closet.
So I played the song at the beginning, Amy Winehouse, who tragically, I love her. She has great music and a great voice, and she passed away at a very young age. But that song was called Rehab, and how she doesn't want to go. So is this Alcohol Awareness Month? That's an issue, isn't it, with people who suffer from alcoholism?
It is. A lot of
denial.
People suffer in silence and denial, thinking that there's something wrong with them as a person. There are a lot of motivational issues that we run into with the population that we work with. So it partly to encourage people that there is help available. You just have to ask for it.
Right.
And that's the biggest lift sometimes, is getting people to say, I'm ready to ask for help.
So it's not even necessarily that you got stopped for DWI, or that you just maybe notice within yourself that you're having issues and you can do some outreach. Is that?
Yeah, absolutely. Yeah? It happens in both scenarios. Certainly there is driving events sometimes that propel people to want to seek treatment. DWIs are a frequent part of that. But it also is people who just realize this is not the lifestyle that they want to live, that they come to a realization either through other self-help meetings or through just analyzing their own makeup and their own life, to say, I'm ready to try something different because I don't want to continue to do what I'm doing.
Right. So I was just reading a little bit, and listeners, you can find out more information online. And the website is www.twincountyrecoveryservices.org.
That's
that correct? Okay, and it's very great, very great website with lots of information. But I see the mission and the history on there. Carl, you want to mention that a little bit? What's the mission of Twin Counties?
The mission has always been to be a resource and a treatment guide to get people to the appropriate level of care. And you'll hear sometimes in the addiction and recovery community, we use that term a lot, because there are different levels of treatment that are appropriate for different people. So the primary mission is to work with people, identify what their substance use of choice is, and what treatment they might be agreeable to. And treatment comes in all kinds of different forms. So they go through a primary assessment process to determine what might be appropriate for that individual. And then so our mission is to work with our partners and within Twin Counties to have that connection made to get them to the place they need to be.
Very good. And it is obviously, hence the name, dual county initiative. So it's Columbia and Greene.
Right.
So there's an office in Columbia County, and then I'm assuming there's one in Catskill as well, or Greene
Right.
County?
So our main administrative offices are here on Power Avenue in Hudson.
Right.
That also
It's a
houses our
lovely
Hudson.
facility,
It is a very
yes.
nice facility, very nicely done.
Yeah, because you used to be up here on the corner of,
We were here on Columbia Street for a while.
right.
And
Yeah, Columbia Street, right up from 401. Yeah,
Right.
on the corner of, yes, yeah.
And so yes, this is a beautiful building, state of the art, modern facility.
Right, parking, privacy, yeah.
Absolutely. And so it houses administrative offices, but that also houses our Hudson Clinic.
Mm-hmm.
And then in Catskill, we have our Catskill Clinic on West Main Street.
Okay.
And then we have two residences. In here in Hudson on Columbia Street, we have our men's Red Door residence. The Red Door houses 13 men for varying durations for treatment. The Riverside Women's Residence, which is attached to our clinic in Catskill,
Okay.
that houses 12 women.
Oh, wow.
And the nice thing about our women's clinic is that not every clinic has been approved to have women and children.
Mm-hmm.
Our particular clinic does allow children up to school age.
Oh,
So you can have your children with you while you're in treatment. Frequently that we hear that's a barrier.
that's a barrier,
to people getting
sure.
treatment
Right.
is they want to be with their kids. So
Right.
we allow for that to happen.
Oh, wow.
And have the children with them.
And so the males are separated from the females, so you don't have those types of issues going on.
Correct. Yeah, so they're two separate programs.
And how does one get into, so you said they're small, which is maybe a good thing, but maybe unfortunate. Is it full all the time?
Yeah, it does. Sometimes there are
Waiting lists, yeah.
depending upon time of year.
And is that
need.
typically like court ordered, or is it need based?
It can be both.
Okay.
So sometimes it is a judge, that orders somebody to get treatment, and then they get screened with our residential director, who is Renee Pine.
Okay.
She oversees both facilities. So Renee does the initial assessment on whether they're appropriate to be in one of those two residences, depending upon sex.
Okay. Because there might be someone who maybe isn't.
Well,
Appropriate?
That's right. That's where we look at appropriate level of care. So there
Okay.
may be somebody where residential treatment is not necessarily the best fit for them.
Right.
And then we would look at something like an inpatient rehab or a different type of halfway house facility for them.
Right. And so I'm reading on, as I mentioned, your very excellent website. There are some FAQs, or frequently asked questions, and you do have a privacy policy. So have no fear, listeners. We will not be discussing anyone's personal situations today. However, in a broad scope, we can talk about, and you can talk about the services that you provide. So just
Sure.
so that we know, but we will mention, because I just saw Carl recently at the drug court, and we can talk about drug court a little bit. There was a graduation program, and I had a family member who graduated. And so I was at the ceremony, which I always find, this is my second time going, for the same person, but we're very proud of him. That it's interesting to see, and I think it's a nice program. Have you found it to be helpful?
Sure. I've sat on the panel
Mm-hmm.
at treatment court since around September or so. And Judge Nichols is our treatment court judge,
Right.
Who oversees the program,
Mm-hmm.
As well as its treatment court coordinator, who is Quinn. And so it's been an interesting dynamic to see the flow of people who come into treatment court,
Right.
with
Right.
varying degrees of needs, but everybody's assessed on what their particular situation is.
Mm-hmm.
And so it's an incredible dynamic. It's nice to see people come in at ground level, not knowing what their recovery looks like,
Yeah.
and then to see them through to graduation is like a pretty impressive thing.
And now, Carl, tell us a little bit, how long have you been involved in this line of work, like this area of expertise, if you will?
Professionally, I've been
Yeah.
doing this for about 4 years.
Okay.
I started with Columbia County Pathways to Recovery,
Mm-hmm.
which was a group that I worked with.
Mm-hmm.
Still involved in the community. I do special advisor work for them, but I no longer sit on their board.
Okay.
And so that was professionally, but outside of the professional stuff, I have two family members who are in long-term recovery
Mm-hmm.
from addiction, and that started probably about 10 or 11 years ago. So we have kind of a long history with
Yeah.
family to start with. Kind of drove both my wife and I to do what we do in the addiction field.
Okay. And so you know from experience, as do I, and we were talking off the air earlier, that I could be a peer-to-peer person because of my experience. And I had been dealing with this since I was a very young child, actually, addiction in my house. So I have experience with it. But like the song said, you really can't, someone has to want to get better.
Correct.
Has that been your experience too?
Absolutely.
You can
there
lead
has to
the
be that willingness.
proverbial horse to water, but you can't make
Correct.
him or her drink. So do you experience that sometimes though, where someone's there maybe because it's a court thing, or we got the DWI and now I have to do the.
Yeah, there are a fair amount of our population that we work with through twin counties who are mandated to
Mm-hmm.
be there through either
Whatever.
court. Sometimes there are child custody
Okay.
issues.
Mm-hmm.
That they're mandating treatment. Sometimes it's a Department of Social Services issue.
Okay.
But then there also is the population who just said, I'm ready to get help and look at what my options are for a different lifestyle.
Right. And what are some of the other services that are offered by us? So you mentioned we've got the residents, the Red Door,
the
and what's the
residential.
women's ones called?
That's Riverside.
Riverside. And so that's in Catskill.
Yep.
So, but Columbia resident can go there.
Yep, absolutely.
Yeah,
Columbia
okay.
Twin County Recovery works dual county, but between both, so anybody can.
Okay.
And we, its primary purpose is to serve Columbia and Greene County,
Mm-hmm.
but occasionally we do have residents from other outside counties
Oh,
who do come
okay.
here for treatment.
Okay. There's a real need for this, isn't there?
Absolutely.
So is it less alcohol related and more heroin and that painkiller type of addictions, or?
On any given day, it really is a split.
Yeah.
And that's, you kind of see where the peaks and valleys come for people recognizing that they're ready for some type of treatment.
Right. Right.
So it fairly evenly comes out, into a split between alcohol and other substance.
Uh-huh.
And it really is classified as substance use disorder, and
Right.
because we deal with all kinds of different substances, it's not just heroin or opiates. There's
Okay.
cocaine use, marijuana
Or
use,
meth, or yeah,
meth,
any number of
any number of things that go with that.
addictive. Right. Okay. And so what are some of the other services that are offered then,
So
Carl?
through the outpatient clinic, those services primarily are where people come to group meetings. The frequency of their meetings depends upon their diagnosis for their current level of active use. Some people only come to an appointment one time a week. We have some patients who do what we call intensive outpatient, which is 5 days a week. And those are for people who are much further embedded into their disease and needed, much more treatment that goes along with that.
Okay.
So it's the residential and the outpatient. And then the counselors also do work with them. So if we're not the appropriate fit for somebody, the counselor and our treatment teams do work to refer them to a different level of care
Okay.
and work without other outside rehab facilities or detox. Some people need
Mm-hmm.
detox before they go to rehab.
Okay.
So it depends on the individual's unique circumstance, what we face them with.
Now, I've worked for a while with, in my capacity at DMV, we used to call it the DDP, but now it's the IDP, the Impaired Driver Program. So this is something that it's a New York State DMV program that DMV has to declare that you're eligible for. So, talk to us a little bit about that.
Sure. So the IDP program, like you said, is a mandated program for people to come into. our with Twin County Recovery Services, we're one of the providers authorized by the Department of Motor Vehicles to provide that service.
Right.
The classes usually run, I think, 7 weeks.
Mm-hmm.
They're 2 hours to 2.5 hours a night,
Right.
and they start on a rotating basis. So we have one that's actually starting on April 30th. That's full,
Mm-hmm.
but then we do have another one scheduled to start on May 7th. That will be for a new round of people.
Right. It's interesting how the program flows. It is all very organized and coordinated with DMV, and I'll just mention a little bit that it's expensive. It's an expensive class. It's expensive to get a DWI, and I will mention to our listeners that New York State is one of the toughest states when it comes to drinking and driving or being impaired and driving, and rightly so. It's a huge issue that can have really horrific impacts. Do you think that the onset of Lyft and Uber may help with that, Carl?
We're hopeful. We want people to realize that there is
There's
a
options.
choice. They
Yeah.
don't have to get behind the wheel. Cab companies, because we're a rural area, cab companies sometimes are harder to come by.
Right. Yeah. A little expensive. Right.
Yeah,
Right.
absolutely. So Uber and Lyft are definite options, and
Mm-hmm.
it's a growing service.
Right.
That's available.
Right. Yeah, I'll have to have Reggie Crowley, and actually he's the county stop DWI coordinator, and I think the state actually has a program too, although I don't know rurally how it's impacted. But, drinking and driving, as I mentioned, very serious. And if you're New York State, I think it was 2011, I'm not going to remember the exact time frame, but they did implement a very strict change in the law in regards to the number of DWIs that you have. Not only does it become a felony, I believe it's 3, but you also most likely will never drive again.
Right.
Which a lot of people don't realize that, the judge can say you're okay, your probation officer can say you're okay, God could say that you can drive, but the commissioner of DMV can say no, and they often do, and it's very you think you're fine and you're just gonna, I'll be fine. And you do it too many times and you're walking or relying on other people. And in rural areas, that can be tough. So please keep that in mind. We'll just do a pause for the cause. Don't drink and drive because it's just not worth it. In addition to the fines, there's usually at least $2,500 in fines if you refuse the breathalyzer. It's an automatic year revocation, even if your case gets dropped. Listeners, that's crazy. Don't do it. It's not worth it.
Not worth it. And the potential to take a life.
Absolutely.
Absolutely. No one wants to ever face that.
Right. Absolutely.
In any
to have to live with that. So talk to us about some of the prevention then that goes on at Twin Counties in regards to, alcohol and other types of substance abuse. You do prevention work?
Yeah. So we do have our prevention group, within Twin Counties.
Mm-hmm.
And so Paula and her group are very actively engaged in the community with prevention services.
Mm-hmm.
And so typically that involves, we have an educator who is out in some of the school districts.
Okay. Oh, that's
County.
good. Mm-hmm.
In Columbia County, Catholic Charities handles that portion of being in the school districts. But in Greene County, that falls on Twin County Recovery Services.
Okay.
Prevention. So they're out in schools educating, middle schoolers, elementary school, about prevention efforts. They also do a fair amount of event tabling, and so we actually just had that at the hospital. We were in the lobby of the hospital for an entire week.
Okay.
Ourselves and a bunch of different Columbia and Greene County organizations for alcohol awareness.
Okay. Oh, right.
And doing that outreach.
Yeah.
And,
okay.
We're going to be at Sean's Run coming up.
Yeah, that's this weekend.
We'll be at that
this weekend. Okay.
So be sure to stop at our Twin County booth in the Chatham High School gym.
At the Chatham High School gym.
People
Okay.
will be there. We'll be at the Interagency Awareness Day that happens in May. Twin Counties will be tabled at that event. And Paula's always actively trying to engage in other events around our community.
Right, just to raise awareness.
Absolutely. Tomorrow night she'll be at, there's an event in Rensselaer County about addiction awareness. And Twin Counties will have a table at that event as well.
Oh, very nice.
Any type of outreach and prevention method that Paula and her group can do to get the message out, they're happy to do that.
So I'll mention, that's a good thing to mention, and I missed the tree lighting that Phil did. on April 5th. But if you're driving by the hospital on Columbia Street, right? Is it Columbia Street?
Correct.
Yeah. So you'll notice so it's by the emergency room. There's a pine tree up on that little hill, and it has white lights and red lights on it, but it's lit all year.
Right.
And that was something that was began, and Phil Abitabel started it in memory of Sean French, and they kind of tied it together. But every red light bulb that you see on that tree represents someone's life who was taken by a drunk driver or an impaired driver, a drug impaired driver. So unfortunately, the tree is getting more and more red lights every year. And he usually holds the ceremony at the beginning of April to tie it in with Sean's Run, which is this Saturday, I believe, in Chatham. It's at the high school. But if you Google Sean's Run, you'll find out the information about that. And of course, it's named after Sean French, who was a high school student from Chatham who was tragically killed in a drunk driving incident. He wasn't driving. He was the passenger in a car of someone who was driving drunk and crashed. So, he had a bright future ahead of him, and it was taken from him way too soon. So you can Google Sean's Run for more information about that. Let's see. There was something else I wanted to ask you about. So you mentioned the community awareness. Pass it on. What's that?
Yeah, so that is a Greene County group similar to Columbia County Pathways to Recovery does here. Pass It On does outreach and education around addiction for Greene County.
Oh, yeah. Talk about the Columbia County Pathways, Carl.
So Columbia County Pathways to Recovery is a grassroots, all volunteer organization focused on recovery and treatment. They work closely with many partners here in Columbia County. One of the larger things that they do that really is a tremendous service is a recovery helpline that they operate from 9 a.m. to 9 p.m. 7 days a week.
Oh.
Where anybody can call, and if you just want to call to talk to somebody, you can call and talk to somebody. If you're ready to get into treatment, you can actually call, and they'll try and get you connected.
And what's the phone number for that, Carl?
I knew you were I believe it is 1-877-HOPE-365.
Oh, see, you did it. You did good.
Trying to remember.
You did good. But that sounds like a great service to be able to provide for people.
and it it's the premise. It was originally founded by a group of moms who got together for coffee one day.
Oh.
Who just said, "Look, we're all dealing with this. How do we help?"
Wow.
And so that was the initial outreach of the group. They reached out to Cheryl Nusafaro, who was Chatham School District
Right.
Superintendent at the time.
Yeah.
And Cheryl facilitated a lot of those early meetings.
Oh, okay.
To get the group started, and then it just has more from there.
It snowballed.
There are people in recovery on the board. There are people who bring their lived experience, but also there are still moms on the board.
Yeah.
Who either are dealing with or have dealt with family members.
Right. Oh, very good.
in treatment.
Very good. Do you think, Carl, what is your position at Twin County? Let me ask that first.
So I'm the assistant director of the Greener Pathways program.
Okay.
In addition to that, I'm a certified recovery peer advocate.
Okay. So we were talking about that earlier. So talk about the peer advocate. What do you do in that regard?
So that role is through our outreach program, which is an arm of Twin County Recovery Services called Greener Pathways. Greener Pathways was initiated through Twin County Recovery Services in September of 2017 when OASIS, which is the New York State organization that oversees what we do, they looked at the number of overdoses, the number of deaths around the state, and Greene County actually fell within the top 16, very close to the top, if I recall correctly.
Wow.
Of the number of counties that were having significant issues around addiction and deaths and hospital visits occurring. So Greener Pathways was funded for that first year through OASIS. And so the Greener Pathways program, we provide mobile outreach. It's mobile in-community service. So typically what OASIS has only allowed to happen within the four walls of a clinic, Greener Pathways can do out in the community.
Oh.
So we have a licensed mental health counselor who is Rachel. You can say, I don't want to go to Twin Counties for treatment, as long as you're not mandated to do that. then Rachel can come out. She can meet you at your house. She can meet you at the library. Whoever you're comfortable meeting with will meet you where you are to talk about what you'd like to do for your recovery. And in addition to that, the early part of the program, it was just our director, our program director is Lori Torgerson.
Okay.
We have Rachel, who is the mobile clinician, and then Dan Ward is our transportation coordinator for Greene County. Those were the three initial ones that
Yeah.
were on board. And then in April of 2018, OASIS provided additional funding to boost some of the Greene County side, but also to start the program in Columbia County.
Oh, great.
So I was initially hired to get the Columbia County program up and running.
Okay.
And then they brought on Kyle, who is another certified recovery peer advocate with us,
Mm-hmm.
and Nejma Donovan, who is in our Greene County, so she's our Greene County peer advocate.
Okay.
But we operate, back and forth between both counties because we're a twin county program.
Right.
We try and focus our staff where we feel we need them most, but crossover certainly occurs depending
Sure.
on need. And then just within the last 2 months, we hired another Columbia County transportation coordinator.
Wow.
So it's, we're hoping that the program definitely has a need here. We proved a need,
Yeah.
by the number of people we're working with, and the outreach and the services that we do. It's a matter of funding. At this point, it's a grant-funded program. So
Right, right. Is that an issue, Carl? I mean, talk to us a little bit about government services. And I know now that it almost seems that, the opioid epidemic has made it kind of, for lack of a better word, it's kind of sexy for government to get involved now. Yeah. Is that a barrier, though, or what do you think is government intervention? And some people want to look to the government as a end-all, be-all, like, they can help, and, is it just more red tape, or is there help that can be done? And
it's a mix of both.
Yeah.
Beth in her role is very
Right.
active with legislation.
Yes, she is. She does a
statewide.
great job. We'll give a shout
Yes,
out to Beth.
She does
Yes.
a phenomenal job. And she bends the ear of people as often as she can to
Right.
say, you want us to help a certain population, there has to be some funding. And
Right.
things that
In
go
order
along
to do
with
this,
that,
right.
to make that happen.
Is it cheaper on this end as opposed to the jail route? And do you? We should talk about that too. Do you feel that what this is doing, is that better? And that actually is kind of the drug court question too, which we can segue into. I'm sorry, I kind of jump around,
No,
but I
that's
think
okay.
of these things. So in my situation, I don't know if it was true in your situation, but I've been to a lot of jails, people. You think but you have no idea. I visited a lot of state facilities, and it never worked. Jail was not and I know there's the philosophies of, it's criminal and, that needs to be done. But when you're talking about addiction, and my family member actually spoke about this, and he said jail was easy for me. It wasn't really a deterrent. So
No.
speak to that a little bit, Carl.
The segment of the population, there is a good chunk of that who come in contact with Twin Counties
Yeah.
through law enforcement.
Sure.
And whether that they end up in jail, there certainly jail is the appropriate situation for some.
Right.
Yes,
Yes, let's put that out
we
there.
do have a coordinator who works in our jail, so she does identify people who are in the jail who might have substance use issues, that there might be an alternative to incarceration program that would work better for them. And some of those referrals do come into drug court. Some of those referrals that she works on are to higher level of care outside the jail.
Yeah.
The jail does a phenomenal job with what they do,
Mhm.
but they're not a treatment facility. That's
Right.
not their primary.
Right. And nor should it be.
Correct. Right.
Nor should it be. But I'm glad to hear that there is, at least now, there's awareness. And I know Sheriff Bartlett has been on top of this, as well as the County Board of Supervisors, that, if you get an addict in and he commits a crime, and or he or she, and they're doing their time, and then, bam, you're out back on the street.
Right. The recidivism rate for
Right.
people just to reoffend
Right.
is high at that point.
So there
because you
needs
haven't
to be
addressed the disease,
right.
At that point. The referrals that Sheriff Bartlett and his team and his program send
Right.
are appropriate
Good.
for what has to happen.
So in that sense, government's working.
Yeah, absolutely.
But the funding is,
but the funding,
yeah.
the funding is issue.
And that's more at the state level.
Our Greener Pathways program originally was funded through April 30th of this year. And so kind of all of us were on pins and needles, including Beth. Beth,
Yeah.
is a great supporter of our program and wants to see the program continue.
Mm-hmm.
But we didn't find out till recently, within the last couple of weeks, that we're actually going to be funded through the end of September now.
Oh, wow.
And then in August they'll have to revisit, for the next round of funding.
Right, right.
So it's this continuous cycle that.
I've
So when you
always
talk
like
about government red tape and yep, here's funding. You go ahead and do what you want to do, but come back and see us in a couple months. And we'll
right,
talk again.
and we'll see if it's
Yeah.
merits the value of
Yeah.
or do we want to spend the money on something
so
else?
A lot of
Yeah.
what we spend some of our time, a fair amount of our time with, is reporting back to Oasis about the number of people that we work with,
More red
the
tape.
number of people
Yeah,
being
yeah.
served.
A lot of
because that
reporting, right?
Produces the need,
Right.
and the backup documentation for the services that they're funding and being provided.
Sure. Okay.
And this grant was initially funded by SAMHSA, which is the federal organization.
Oh.
It was given to Oasis, and then Oasis could distribute to what they felt were most important to work.
Okay.
So there's a federal level of reporting that Oasis has to do
Based on
data
what?
that we give them.
Oh, wow. Can you talk numbers? How many? How many?
Though I'm not, I know what I see as current caseload
Yeah.
that working. So we probably, between our three peers and the mobile clinician, right now we have a caseload of about 140 people that we're working with.
Wow.
Active,
Wow. That's a lot. Isn't that a lot?
It is a lot. Then that's separate from what Quinn County is seeing through their regular clinic process.
Right. Okay.
And those numbers, I don't have
Yeah.
access to specifically what those are.
Right.
But both of the clinics are actively having people come in for assessments. Sometimes there's a little bit of a waiting period when they come in to have that done.
Right.
So that the need is there. We're all working, as best we can with the population that's out there.
Right. And with the resources that you have.
But
Yeah.
it is a big lift for two rural counties.
Right.
To be able to provide what we're being asked to provide.
Do you think, is it more of a rural county issue, these types of, or does it really know no boundaries?
No, the disease doesn't know. There are no socioeconomic boundaries, no race boundaries. This is across all segments of our population
Yeah.
that experience this.
Do you get into any of the nitty gritty of like whys? The whys? Like,
As we work with people to try and identify treatment and find out what's appropriate for them,
Mhm.
there is a fair amount of what brought you to this, what in your life drove you to get to this point
Right.
where you felt this was the only thing you could do to make your life better. And that's part of addressing treatment. That it's
Yeah.
the same for mental health. It's the same for people who are overweight. It's the same for people
Yeah.
who have diabetes or heart disease. There's something that got people to that point.
right.
So we do try and address that as part of their treatment.
Wow. That's a heavy lift.
It is.
That's a big weight to bear for the people working. Is there a lot of turnover, or you have a staff
There's not.
doesn't get burnt out?
No,
Yeah.
our staff that as with Greener Pathways has been with Greener Pathways since the beginning, since we were all hired.
Wow.
And there is a component of what we call supervision
Mhm.
that goes along with our positions, and not what you would think in your traditional sense of supervision where you would supervise staff at DMV and at your
Okay.
property.
Uh-huh.
But a person who talks to us about what we're experiencing and what troubles we might be seeing, and if there's anything with a particular client that's causing us undue stress.
Okay.
So basically
you
an
have
opportunity
resources to
decompress.
Right. Okay.
And we, in this particular role and in the clinical role, everybody has to go through that.
Oh, good.
Everybody has somebody that's assigned with them to provide supervision. So there's some outlet for what we're experiencing.
That's good. That's good to hear. Because it's probably got to get a little.
It gets a little younger kids hit closer to home for me in
Yeah.
particular
Yep.
for
Okay.
what my situation was.
Yep. Yep.
But it's different for everybody.
Right. Right. Now, do you see a lot? Are there mental health issues that go along with the addiction issues?
Most of the time, there's what we refer to as a co-occurring disorder.
Okay.
So it's mental health and substance abuse. So the role typically is to decide which one has to be addressed first.
Oh.
And in some cases, mental health needs to be addressed before we can deal with the substance use disorder.
Wow.
And so those are referrals to appropriate level of care for mental health.
Right.
And then certainly they can come back into our clinic and our treatment programs
Once they're able
once
to.
they're mentally stable
Yeah.
with that.
Okay.
But there is a definite component of dual diagnosis
Sure.
that goes with it.
Okay. Now, I wanted to talk a little bit about your outpatient clinic services because I see that there's a 24-hour crisis hotline.
So that runs through our Red Door. The staff
Oh, that's the Red Door.
The staff
Okay.
at Red Door provide our 24-hour service. And in most cases, they're taking information and they're referring to us the next day.
Okay.
If it's something that rises to a different level than we provide, then they would do a referral to mobile crisis.
Okay.
And the Katie and the MCAT team would become involved at that point.
Wow. Can we give the number out? Can I give the number out?
Yep.
So I won't put you on the spot. It's right here in front of me. So there is a 24-hour crisis hotline, and that number is area code 518. So it's a local call. 518-822-0090. Now, I didn't put my little cheaters on that Lori gave me. Let me make sure that, yep. That is right, 0090. So, and it's through your Red Door facility, but they do they direct the call
They
where it
direct
needs to
the
be
call
based
out to
on,
where it
and
needs
it
to
could
go.
be any crisis, like I'm inebriated and I feel like I want to hurt myself kind of thing,
Yeah,
or
they get a fair amount of those calls, and in those calls they do a quick assessment whether it's an appropriate referral to 911 at that
right.
point.
Okay.
If somebody is in an immediate
Wow.
crisis.
It's nice to know that there's that resource. Are there other resources that for I know online, and then you mentioned so there's the community outreach. Actually, I did want to ask you this. So, especially for the people going through the IDP, is your facility here in Columbia County at any rate? Is it on the bus route? Should it be?
It is not on the bus route, and it is something that has come up with some of the population that we work with.
Oh, we'll have to talk to the chairman about that.
Absolutely. Good point for advocacy.
Yeah, yeah.
Absolutely. The one thing I didn't talk about with
Go
Career
ahead.
Pathways
Yeah.
is our transportation
Oh,
component.
yes, you're right, which made me think of the bus thing. So yeah, talk about that.
We do in Columbia County. We have two vehicles. We have a 9-passenger transit van, and we have an SUV vehicle.
Oh.
And in Greene County, we have that same setup.
Wow.
So we can provide transportation to people who don't qualify for Medicaid transportation. Then we'll provide that service as best we're able to get people to the clinics for their appointments.
Oh,
or
very
other
good.
appointments.
And go ahead.
But the other part of that is that Medicaid transportation doesn't cover anything that's not medical, of course.
Right.
So if you want to go to an AA meeting or an NA meeting, you can't call up Medicaid transportation and get to those.
Right.
So our service provides that transportation to people
Oh.
who need that level of service.
Very nice.
So we're frequently here at the Goya meetings that occur in Hudson.
Mm-hmm.
At the church on Green Street.
Okay.
And there are meetings in Catskill. So we do a fair amount of moving people to where they have to get for that next level.
Right. Oh, good.
For people who are interested in self-help meetings.
Oh, that's good to know.
We do that. Through our peer advocate program, we take people to court, so we can attend court appearances with them.
Okay.
We'll take people to DSS to help them apply for public assistance.
Oh,
or
very
food
good.
stamps. So the transportation really is the wraparound service because of the rural community
Sure.
nature that we have.
Right.
And although we'd love the bus service to be, up and running everywhere,
Right.
we cover a fair amount of distance between our two counties. It's
Yeah.
a large rural area.
Sure. Oh my gosh.
So that's
yeah.
not, no matter what we do with the bus service, we'll never cover everything.
Right. No, exactly. That would be a big lift. But and then you brought up another good point about costs. So unfortunately, there's a cost associated for someone who needs treatment, I'm assuming, and
Right.
So how does that work? Is there insurance involved?
There is insurance. So,
Okay.
so that's really one of the first questions. If you were to walk in our clinic, you're going to fill out an information packet,
Mm-hmm.
and insurance is going to be one of those first questions that are asked.
Yeah.
But just because you don't have insurance doesn't mean you're not going to get treatment.
Okay.
So Twin
Good to
Counties
know.
does do a sliding scale policy for people who don't have insurance.
Okay.
But through what we do with our peer advocate program, we can actually take people to get them signed up for insurance.
Oh.
They might feel that they don't qualify or they don't know how to go about doing that. So we're linked very closely with the Healthcare Consortium
Mm-hmm.
and also with Alliance for Positive Health, who both have insurance navigators.
Oh, okay.
So we can make sure that you get connected so that if you are eligible for insurance services, your insurance will cover that.
Oh, very good.
But under New York state law, insurance should never be a barrier to treatment.
Right.
There are New York State OASIS facilities who are mandated to take you,
Okay.
even if you don't have insurance.
Okay. Good point.
There's a waiting list.
Right. Of course.
Because of the
Right.
nature of our business.
Right.
But that doesn't mean that you're not going to get in. You just may have to wait.
To wait. Okay.
For an opening.
All right. A little bit. We're winding down here in our last 3 minutes, Carl. Anything else that you want to make sure our listeners hear about?
Just the county services that are wrapped around
Mm-hmm.
recovery and support.
Yeah.
We have close partnerships with the Columbia County Department of Health, Columbia County Mental Health, Greene County Mental Health. We work closely with the Greene County Family Planning Clinic now, who is a medication-assisted treatment provider.
Mm-hmm.
I think it's all about partnerships. I don't think
Yeah.
people necessarily realize. They hear there are not a lot of services available in Columbia County.
Yeah.
And that's true. We don't have a detox facility. We don't
Right.
have a rehab facility here.
Right.
But there are connections to get you to those facilities.
So there is hope.
there is hope,
Yeah.
absolutely. And we
a good
talk
message.
about that with people every day.
Good.
that there is hope in recovery. You just have to want it, and you just have to ask for
Yeah.
help. It's one of the things as peers we struggle with, that people have kind of given us a preliminary, I might like to work with you, but I'm not really sure.
Oh.
And we'd like to drag them along kicking and screaming and get them to go.
Right.
But we know that they have to self
People have to want it. Yeah.
To say, I'm ready to accept the help, and I'm ready to do this.
Right.
And traditionally, treatment doesn't work unless somebody's ready to accept that.
That's
level.
very true. Very, very true, unfortunately. But obviously there is a need out there. And I'm glad that you came in, Carl, to talk to us about that. This was awesome.
Having me.
Appreciate you filling in. So again, this was Carl Quinn from the, I lost it, Twin County Recovery Services, Inc. So their general phone number for Columbia County is 518-828-9300, and Greene County, because we have listeners over there as well, 518-943-2036, and online twincountyrecoveryservices.org. So all sorts of information if you need help or someone you love needs help and you think they're ready. There's a whole gamut of situations
Reach out. We're
that
happy to talk.
people are dealing with. But yeah, you heard Carl. Reach out. There's hope. That's always a good thing to remember, that it's never hopeless, even though people feel that way sometimes. So this has been Talk with Tanner, and I want to thank my first guest, Lori Weaver from Our Community Cares. Right? Yes, Our Community Cares. So again, their event on Saturday, May 4th at the VFW in Ghent. You can go to ourcommunitycarescc.org for information. And then Carl from Twin County Recovery Services talking to us about Now We Know, Vern. Now we know what April, the Alcohol Awareness Month banner means. It doesn't mean go have a drink, although you can. Just don't drive and don't overdo. Everything in moderation, right? Although we did learn at drug court graduation that some people, moderation doesn't work at all. So you got to have a water. Yeah. And that's okay too. There's nothing wrong with that. Life can be fun enough without that. So thanks for listening. WGXE 90.7 FM, listener supported